We are talking fact and fiction when it comes to colonoscopies. Hello everyone, I'm Joe Basikia, along with Dr. Khaled El-Badawi. He is a colorectal surgeon at Virtua. Good to have you here, doctor.
Thank you for having me.
Okay, so let's go right through it. First, I have to show signs before I have to go get a colonoscopy.
This is not necessarily true. There actually is a recommendation as to when to start colonoscopies. And obviously, other than the recommended starting age of 50, if someone does have symptoms at an earlier age, they should really seek out their colorectal surgeon or a gastroenterologist to get a colonoscopy done at that point.
Okay, so have to get a colonoscopy. That prep for the colonoscopy is unbearable.
This is another myth. In days past, some of the preps would almost taste like salt water. However, nowadays, some of the preps are quite mild and may even involve sports drinks or power drinks.
Go get that colonoscopy. It's done. I am in the clear for good. It's one and done.
This is not quite true also. Colonoscopies, once you've had your first one, that is going to be your baseline. If the findings are pretty clear, we'll recommend having one done a little further down the road. If there are findings that need to be addressed sooner, then the recommendation is to have it sooner.
I don't know about those doctors. They're always going to find something when they do that colonoscopy.
Now, this is a myth. Colonoscopies, a lot of times, will find a totally normal finding. In that situation, we know that the risks are low, and the individual can come back in a longer time interval to have their follow-up. Here's
a big key question for you, Doc. The colonoscopy is a very important test.
I believe that indeed is true. The mantra in medicine nowadays is preventative medicine. And the whole point of getting a colonoscopy done is to try and prevent dealing with a colon cancer that could have otherwise been prevented had we done a colonoscopy sooner and removed polyps or the like.
You are all about healing. I imagine you've unfortunately have come across folks that have waited too long.
Yes. Unfortunately, if we have simply ignored the signs and symptoms and dealt with symptoms of bleeding or pain, a lot of times we will actually find they actually come in with very advanced stage problems that, once again, could have potentially been prevented.
Dr. Khaled El-Badawi, thank you so very much for being with us. He's a colorectal surgeon at Virtua. To learn more about colonoscopies or to learn more about Dr. El-Badawi or any of our physicians, simply go to virtua.org.